All right, ladies and gentlemen, we are going to go ahead and get started. Thank you so much for joining us today for our Rutherford Works Ready to Work Employer Showcase with At Home Healthcare. We have the HR manager and recruiter, Cindy Moore, with us today. She's going to be giving you some details around the culture of the organization, what jobs they have open and available to you, and also some helpful hints on how to apply, where to go to look for that information, and also how to get in contact with her directly. So without further ado, I'm going to turn it over to Cindy. Let me also remind you all, please keep yourself on mute so that we don't have any additional background noise. These will be a recorded aspect placed on our YouTube page where you can find it later if you missed an aspect of notes. And then if you have any questions, feel free to put those in the chat box. I'll be monitoring that throughout this time today, and we will ask those questions of Cindy when we get to the end of her presentation. All right, Cindy, I'm turning it over to you. Oh, I'm sorry, Cindy, you're still muted. Unmute yourself. You're good.
All right, thank you so much. I hope everybody's doing well, staying safe, staying healthy. We at Home Healthcare have been in business, as you can see from our website. We're celebrating our 25th anniversary this year, so yay. We are a locally owned and operated company across the state of Tennessee with over 20 offices. So our unique aspect is pretty much wherever you are in Tennessee, we have career opportunities available. We have several kind of spokes in our wheel of opportunities. We currently have multiple positions open across the state, many in Middle Tennessee. I want to just kind of guide you through our website to kind of give you an idea of what we do as a company, who we serve, what services we provide. Our homepage, we are an in-home healthcare provider. We service, like I said, the whole state of Tennessee. Some of our services range from homemaker services. We do in-home respite, personal care attendant, personal care services. We also do some private duty skilled nursing staffing. We have private pay services, VA services, and workers' compensation disability services. A little bit about our locations. Sorry, my website is a little, there we go. This kind of gives you an idea of all of our locations across the state of Tennessee. Anywhere you see the dot, that is the office location in those areas that are color-coded are our areas that we serve. So these are all of our locations across the state. And it's color coded so you can see. So in Rutherford County, our Murfreesboro office is located on Merchants Avenue, and we service the Rutherford and Canning County areas out of that office. But it's color coded, so it makes it a little bit easier, but we do service clients in all counties across the state of Tennessee. A lot of what we do is non-medical, non-skilled services. So we hire caregivers and CNAs to go into individuals' homes, and we provide daily tasks of living. So we can assist with bathing, we can assist with getting someone dressed, light housekeeping services. We do some transporting. We also assist taking them to doctor's appointments or running errands, different things like that that they may need. And we do all of our training. We do extensive training prior to anyone going into a home. So we do hire caregivers and CNAs for those positions. And we have those positions open in all of our Middle Tennessee offices and all of our offices statewide. If you go over to our career page, it kind of gives you an office by office breakdown of the openings that we have in those areas. Like I said, we've been in business for 25 years. We're locally owned and operated. We are huge into employer. We support our employees. Whenever it's not, we don't have a lot of gatherings right now, as anyone doesn't during COVID, but we have a very family atmosphere, very supportive. But this, to get us back to this page for our careers, so it kind of goes through all of our offices and any available positions for those offices. It also breaks down the counties that those areas service. So if we scroll down, we can go down to the Murfreesboro office. We have quite a few, so let's go down to Murfreesboro. And it goes over all of our positions. So for a personal care attendant, if we wanted to apply to that position, our application process is super simple. It goes through all of the description, everything that's required for the position, what's expected. It goes through all of that. All of our qualifications are listed. Once you go through all of that, it's super simple. Where the apply now is, you'll enter your information, hit submit, and it'll take you straight to our application. Right now, we are doing a lot of virtual interviews. So as soon as an application is received, we do reach out to try and get that scheduled. As you can see, we have availabilities across the state for our Murfreesboro location. We are looking to hire personal care attendants, certified nursing assistants, skilled nursing. We do staff for, as far as skilled nursing, which is the more of the home health aspect, which is the skilled nursing, and that is where for CNA, some CNAs, but mostly LPNs do those positions. So let's see, that kind of wraps a lot of that up. I usually, I know we have a Q&A section, so hoping that there might be some questions or anything that I can go further into detail on, anything that anyone may be curious about. We do have benefits. We do offer medical, dental, vision. We have paid time off. We have a wonderful benefit program for our employees. Like I said, our employees, we treat them like family. We know that they go out and they're our hands and feet, and they're on the, they're in the homes doing the services, and we have wonderful clients. Our client population ranges anyone 21 and older with a variation of diagnoses. So, no patient is the same, and we appreciate so much our clients going into these homes and providing services that are very unique. It's very neat to be able to go into somebody's home and assist them with something that they are no longer able to do on their own. And so it's really interesting to get into a home and see that bond form between a caregiver and the client, and it's really it's important that we have this kind of service to provide. And sometimes I think that people are like, oh, but it's wonderful to be able to go into somebody's home and to assist them. And maybe you are preparing that home cooked meal for the week for someone, or maybe you're hearing a story from years ago, or maybe they just want to share their stories and those kinds of things. So it's a unique opportunity to get in and to really provide a service and to change somebody's life, to make a difference. There's so many different things that I could say about this position and go on and on, but we are interested in hiring people, and we need good people to come in and help with these clients.
Thank you, Cindy. I feel like listening to you, you're really looking for people that may have some transferable skills, so people that might be looking to change careers, or for students out there that are interested in getting into the healthcare field, that compassionate care aspect, learning bedside manner. how to truthfully be kind and interact with someone who you might not have had a relationship with beforehand, or some skill sets that you might be looking for.
Right.
And as you describe those things, I know that you're also looking for CNAs and LPNs. So could you tell us, what type of certifications you need for specific jobs? I know that as you were going through the jobs that are available in Murfreesboro and Rutherford County and Cannon County, you have some skilled positions and some that aren't. So could you describe the difference for us?
Yeah, so personal care attendants, we train you to become a personal care attendant. All of those things, that is all done leading up to employment. And then once you once you are hired on, you go into training into a patient's home. So it's very hands-on. There's a lot of training involved. But the personal care attendant is it's an unlicensed caregiver. Okay. And then we have a CNA, which is a certified nursing assistant. LPNs are licensed practical nurses. So, and the LPNs do more of the skilled nursing. We do have CNAs that come in and they do a lot of our non-medical, non-skilled services as far as the activities of daily living. But we have the personal care attendant for someone that may not have a CNA license, but they're interested in getting into that field and seeing, hey, is this something that I'm interested in, kind of pursuing further? And I find that when I speak in high schools or when I go to colleges or anything like that, it's such a flexible position. It's very unique in that where, you could say, hey, I really only have these days and these times allotted that I can do this because, I'm in school or I'm in college, any of those things. And so it's really unique where we have patients that have schedules that meet your availability, or, you can just say, hey, I only want to work these days. So it's very convenient to get into it if it's something that you're just kind of wondering, is that something that I'm interested in moving forward on? And a lot of times people are surprised and they're like, this is what I want to do. And so they start on with us as a personal care attendant, and they may go through a CNA class and then they become a CNA for us. And then they're like, I like this nursing thing. And so then they move in and they go to nursing school and they do skilled nursing for us. So we really can grow with someone throughout their, career path and opportunities. Longevity for us, we have people that have been with us for 10 years. It's like I said, we are a family. So once we get you in here, we like to hold on to you and, all of those things. So I have been personally with this company for 8 years, and I couldn't imagine being anywhere else. I love it.
That's so awesome, and what a great testament to the organization as a whole.
Yes.
Now, you mentioned benefits a little bit. Mm-hmm. If I am a job seeker, one of the questions that we've had is, when would my benefits start? Do I have to be full-time? Do your part-time employees get benefits? Could you tell us a little about that?
Sure. We have different benefit packages. Like I was saying before, we do have the PTO, we have the medical, dental, vision, we have other kind of short-term disability insurance too. Those come into play if you have to work a minimum of 20 to 30 hours a week for those benefits to be in play. And there is a waiting period for those. Typically, you have benefits available to you around your 8th month of employment.
That's great. Thank you.
Yeah.
Another question. You mentioned that sometimes you all will transport patients to and from appointments or to run errands. Would someone interested in a job like this, is that something that they would need to do in their own vehicle, or do you all have vehicles that provide that type of service? Can you give us a little information on that?
Yeah. You are not required to transport if it is something that you choose to do. We do all of the, we have to have in motor vehicle report, we have to see valid driver's license and auto insurance, those types of things. We do encourage to use a patient's vehicle, but if that's not available and you feel comfortable utilizing your own, that you may. But we do encourage utilizing the patient's vehicle. And like I said, it's not a requirement.
Wonderful. And then my last question is, I noticed when you scroll down again to the Rutherford County, Cannon County jobs available, there might be one listed that says CNA or a patient care tech. Does that mean there's only one position available, or are there multiple positions there?
I don't stop hiring. There's not going to be an end to someone needing the services that we provide. So there is no end to, we are always looking for wonderful individuals that are caring and compassionate and that are looking to do something like this. So no, there's no limit on hiring. We are always looking.
I love it. I love it.
Yeah.
Well, I am checking the chat box and I don't see any other questions listed. I'm going to give you guys just a couple seconds in case someone is typing something in. And then I'm also going to give Cindy kind of a last words, any advice if you're applying. Should people also reach out directly to you after they apply on the site?
Yeah, they absolutely can. I know you're going to share my contact information. So absolutely, if it's something that you just have a question about and you want to contact me directly, absolutely. I'll get you all the answers that I can give you, all the information that I can give you. If you're just curious a little bit more about, just anything within the company, please feel free to reach out. If you go on and you apply, you will be contacted very quickly. And you're welcome to send me an email and let me know that you applied. We were very excited about the potential opportunity to get some good candidates.
Well, awesome. I don't see any more questions in the chat box, Cindy. Thank you so much. Like you mentioned, I will be sharing your information with everyone that's on the webinar today. This will also be on our YouTube page, so you guys can come back and listen to Cindy's tips as you're looking to apply for at-home health care. Yeah. And I thank you all for being here, and I thank Cindy for taking some time with us today.
Yes, thank you so much.
Awesome. Have a good day, everybody.
You too.